get to really see students over and over again, building those relationships with students. So, some of them have come up to me, after class and want to learn more about this program, want to learn more about residency, or just thank me for, giving the lecture. So I feel like that's another very rewarding thing, is getting to build these relationships with these students and see them grow throughout the year.
I think our PGY2 program is a great fit for candidates who are interested in academia. So we have a strong clinical component with the VA and Piedmont as our core sites, as well as other electives to complement residents' interest. In addition to that, there's lots of opportunities for teaching. And so teaching in the classroom, precepting students, teaching in labs. If academia is of interest, we have a very strong curriculum to support development in that area.
We're a smaller program, and I think because of that, that really allows you to be treated like a colleague or a junior faculty member. Another thing that I think is unique about the program is the multiple practice sites and the different patient populations that you're able to interact with because of that.
Not only do I get to practice with patients or veterans, but also get to learn what it's like to develop a CPA, create a business plan.
When residents first join me in clinic, we assess where their strengths are and where they need more work. So some residents will have had great exposure to Epic. Residents who've been in the VA may not have ever used that EMR. So we first at baseline figure out where we need to go with just the logistics. Generally, I have the residents shadow me for a day or two, and then we move pretty quickly into having them see patients independently. Towards the end of the residency year, the expectation is that residents are carrying a pretty full patient panel. We're splitting our patient load and working side by side as peers.
We have a high level of patient care when we practice at the VA with our scope of practice, which means that we can initiate, change, or discontinue medications, order labs and order consults and all of that sort of thing for all of the patients that we see and for disease states for which we see need.
I think our site provides a very unique opportunity to work on both teaching, research, clinical research, and one of our missions is to make a resident capable of walking into any VA and practice as a clinical pharmacy practitioner with their feet running.
It's an opportunity to see the whole gambit of what clinical pharmacists can actually offer to healthcare, and in our residency program there are many opportunities to further their knowledge base.
You're doing everything. Patient walks in, a particular patient walks in, and you never know what that patient is going to request, and it can run the gamut all the way up to maybe we have to then triage to a tertiary setting into the hospital. So it runs the gamut wide open.
Another aspect that I originally drew me to this program was the ability to get to work with veterans and community patients. So I have veterans in my family, so it's a population that's pretty close to my heart. And just the way that practice is different between the two groups. So I get to really get this holistic idea of what it's like to work in the VA as well as Piedmont. So I feel wherever I end up, I feel I'll be well equipped to go anywhere after this year.
We've had several residents that have gone into clinical teaching positions with universities. We've had several residents go straight into clinical practice with the VA.
The program itself is challenging but very rewarding, and it gives you a different perspective on clinical pharmacy.
I always talk with the residents throughout the year and ask them at the end of the year how they feel about their accomplishments, and they're always so amazed at everything that they have accomplished throughout the year, from just developing their patient care skills as well as all of the scholarship and the teaching that they have completed. It's just really a great experience.